Hello, everyone. Welcome to Optimism and Opportunities in Oral Health. I'm Anne-Marie Gothard, Vice President of Global Corporate Media Relations for Henry Schein. We're excited to present this program because it brings together Henry Schein leadership with the current and past presidents of the American Student Dental Association to share perspectives on the present and future of the dental profession. It has become an annual tradition since 2016 for our Chairman and CEO, Stanley Bergman, to connect with the current president of ASDA to discuss high-level trends in dentistry on our Shine Chats, our social media video series. In fact, our first segment of the program is a bit of a reunion, featuring a discussion about the future of dentistry between Stan Bergman and Dr. Sohaib Solomon, who sat together nearly 6 years ago for the very first Shine Chat between Henry Schein and ASDA.
Hi, everyone. Thank you for tuning in. It's been 6 years since I had the opportunity to spend a little time with Dr. Silliman, who at that time, 2016, was the president of ASDA. He's now in private practice in Seattle. What's happened in your life and why private practice in, of all places, the beautiful rainy city of Seattle?
Yeah, I can't believe it's been 6 years, honestly. I look at the clock and I feel like we just had that chat, literally last week. A lot has happened. It's kind of funny. Last time we spoke, I was planning on pursuing general dentistry and I was going to, get involved in that. And it was I'd always had this passion for oral maxillofacial surgery. I kind of just loved it. I loved the surgery. I loved kind of the more medical aspect to it. The more involved that, just the surgeries in general were just so cool. So huge pivot kind of in my career since we spoke. Ended up getting accepted to University of Buffalo for the oral maxillofacial surgery residency. Finished my time there. And then, so you talk about kind of how I ended up in Seattle and in private practice. The program I went to, and I got to speak, kudos to the University of Buffalo. It was very well-rounded. We had a new department chair, Dr. Michael Markwicks, who brought in with like a huge craniofacial head and neck cancer. So, I was neck deep in these enormous surgeries and 16-hour surgeries. We'd be living in the hospital for weeks on end, trying to take care of these patients afterwards, very complex patients. And so after I got done, I kind of thought I wanted to pursue that avenue, and God bless anyone who does it. But I realized that maybe this isn't the best life for me. And so there's other facets of oral surgery that I truly enjoyed, including the dental alveolar, orthognathic. So I actually, and this speaks to the power of social media. The job that I actually got in Seattle was through an oral surgeon, Ben Johnson, who has a relatively large Instagram following. And I kind of just texted him like, hey, do you mind if I come see you out in Seattle? I just want to come shadow. He wasn't looking for a job at the time. We linked up, and then a year later, we clicked. He liked me. It gave me plenty of opportunities out here for growth, hopefully future partnerships. So it just made sense for me to pursue that private practice route versus, some of the more DSO organizations. There isn't quite as much of an opportunity for oral surgeons to partner and grow themselves, business wise. So to me, it seemed like a good deal. When I graduated University of Washington, I swore I'd never come back because of the rain. I ended up falling in love and marrying a girl from Snoqualmie. It's kind of close to Seattle. And when she said, in terms of like moving back, when we had our daughter, we wanted to be close to family. So here I am, came back to Seattle. And I got to tell you, life as an oral surgeon is definitely a lot better than life as a dental student when you're back in Seattle. So.
Or an oral surgeon resident. I think that.
That's not, I don't even talk about that. That's a PTSD memory I kind of locked away, and I don't ever want to pursue that. Yeah, so a lot has happened in 6 years. It's an honor for you guys to have me back. I always enjoy our discussions. Last time it was very fruitful, and I'm excited to chat more with you about what you've seen evolve in the last 6 years, and just how dentistry as a whole, and if we've made any strides since we last spoke as a community, or as an organization, or even as a profession to address some of the issues.
It is said that during the last 2 years, maybe 10 years of technology advancement because of COVID. Just technology has advanced. We know that in dentistry, same-day dentistry has gone through the roof. People just want to get done with one visit to the dentist. If they have to have some restoration, they don't want to go 2-3 times. They just want to get it done right away. Instant scanning versus impressions. How has your world, the oral surgery world, developed over the last What's it, 6 years?
Yeah. You know, it's interesting because there's the field of oral maxillofacial surgery is so broad that, you know, and it's the one thing I love about the field is that it extends into both medical and dental. So I remember just sitting when I went through doing some of the surgeries, some of the more complex traumas on that side. I remember, for example, like orbital floor fractures. Some people, you know, you have to replace the socket of their eye with a metal sheet, and they had like CT guided surgeries where we actually can see real time where we're placing the metal titanium sheet versus kind of the direct visualization required in the past. Same thing with CT guided for a lot of the other stuff in terms of like when we were trying to do cosmetic surgeries, you know, re-advancing or shaping people's cheekbones and just perfectly lining it up without even having to guess looking at it ourselves with the CT guided stuff. Also, just when we talk about some of the stuff I did in residency with the head and neck cancers with patients that we had to resect large portions of their jaws. And, you know, we do this virtual surgical planning, which just blew my mind, where literally from step one, we upload the CT scan, we plan all the parameters, print out cutting guides that are accurate within less than a millimeter. We literally, in terms of like where if we want to place implants in the leg, when we have the fibula, we replace it. That's all planned previously. Implant guides are all printed. And I remember watching the first surgery that I sat in, and this is something that really kind of gained steam in the last 10 years. And I remember watching it, that literally, even if you didn't know what you were doing, somebody could walk you through the entire surgery just because it's literally all planned that well for you. And then when I left that kind of more medical side, just to the dental side, I know we talk about like the one big thing in dentistry is like same day crowns, things like that, where patients can come in, have the crown prepped, printed, and literally they walk out with a brand new tooth. And on our side, one of the things that I loved is this, you know, when patients come in with just where maybe their entire mouth just isn't restorable. And we can do the same thing with the CT guided, the planned, all that stuff to literally they can come in, take out all their teeth, put in 11 implants, and they can walk out with a brand new smile that's not a normal denture, but actually a fixed brand new smile. And so you talk about dentistry in a day. I mean, that's an entire new jaw in a day. So, you know, it's phenomenal, just technology and where it's coming from. And I think some of the pushes too are just in the biomaterials, just the new membranes that are out, the new bone. Every year, I feel like there's something new that people claim, you know, will bond faster, will integrate faster. The implants with some of the companies we work with, I mean, it's almost like you can't keep up to some extent.
Yeah, but it sounds very stimulating.
It is very stimulating, yes.
So I think 6 years ago, so we spoke about the notion that there's a direct correlation between good oral healthcare and healthcare in general. You live a healthier life with good oral care, costs less to maintain your standard of health. If you're treated for an issue, medical issue, okay, if you've had it, leads to better outcomes. So you're right in the center of this, being an oral surgeon, because actually you have one foot in dentistry, you have the other foot in medicine. How do you think this is progressing? And then maybe as a follow-on to that, what can we do to align oral care with healthcare in general?
You know, I got to say, I think my eyes have definitely opened a lot more to this issue since we last spoke. I'd been kind of looking at it more from the dental side. You know, there's some interactions you have with some of these patients and you talk to their primary care doctors, try to kind of organize the two sides together. But I think, like you said, just in the field that we're in, we're kind of blessed and it does make things a little bit more difficult, but we end up with dealing with a lot more of the sick patients, a lot more of some of the stuff that you say in underserved people with not really much access to healthcare. And I remember just being absolutely blown away at some of the stuff I saw in the hospital in terms of like dental care. I thought I saw some of the worst when I was in Seattle, but when I got to Buffalo, and that's not just in Buffalo, it's anywhere across the country, you have pockets that are like this. But I remember seeing patients that would, from a simple, I got to tell you, Stan, I'm not lying. This patient, somebody who's poorly controlled diabetic, poorly controlled heart conditions, and they'll come in, that's their blood sugar is so uncontrolled that a simple dental abscess that on you and I, maybe a little bit of swelling, a little bit of pain, you go to a dentist, get some antibiotics, get a root canal, you're fine. These patients will sleep on it. And I literally saw these patients come in with imminent airway issues where they can't even breathe anymore. The swelling is so bad that and the abscess is so bad, they're now septic. So their entire body's shutting down. We take these people to the operating room. We literally end up having to perform tracheostomies on them, giving breathing tubes just so they can breathe past the abscess, end up in the ICU. We're controlling their blood sugars on insulin drips. These patients, some of the stuff will actually progress, and I don't mean to gross anyone out there, but literally the flesh-eating bacteria. These people will take 4 or 5 trips to the hospital, to the operating room, just for us to continue to debride and clean it all out. Whereas if this gentleman or this woman had just been seen a year or 2 earlier and just had seen a primary care doctor, had their blood sugar controlled, they would have never ended up with this hospital bill that's now upwards over hundreds of thousands of dollars, depending on how long their stay is. So, I mean, it was very shocking to me just what the system looked like. And it wasn't just that. I mean, we're talking just on the trauma sides, things that just a person with normal access would not be nearly as afflicted. One thing that I did appreciate more and that I like there is that I felt from my time there that there was a little bit more of an eye opening on some of the medical doctor side, just about that correlation between the oral and systemic health. So we would have a lot of, other doctors that would call us and would say, hey, like, we have this patient on our service. We think that there may be a possible dental relation as to why their blood sugar is under control or their infections out of control, and they would actually call us to come in and see the patient. So there's more of that understanding, and I think for us to continue to progress as a whole as healthcare, there has to be a continued communication between both sides. And I think that's a nice part about being where I am as an oral surgeon, is that we're able to facilitate when the dentist calls me, and then I'll call the primary care. We'll sit down. Patients that are on chemotherapy, cancer treatments, I can sit down and have that intelligent conversation with someone and know how to properly treat their dental ailments, or vice versa. Patients that are undergoing cardiology surgery, they can come and talk to me, and I can set them up what's best for them. So very eye-opening, Stan. I got to tell you, it's almost like I lived a different life for 4 years during my time in Buffalo.
You think we're making progress as a society, and what can we do really to make the public aware? Because
it's like the $1 million question, right? I mean, I think, and that's the issue. I think with healthcare, and this is sad, there's just too much politics involved. And I think people forget that as a human being, people need help and they need to be treated. And the problem is, once money gets involved, once politics gets involved, now all of a sudden it's no longer about the patient, no longer about the issue. And I think that's the problem, is that there's just this continued divide. And I don't preach one way or the other. I don't care if it's Medicare for all or if it's private practice for all. I'm a fan of healthcare for all. I don't care how it's done. But to me, I mean, this system cannot maintain the strain it undergoes with simple things that could be treated so much earlier. And for them, and we saw it with COVID. COVID just pulled the blinds right off of everything. Just the overrunning the hospitals, nurses that were leaving because they're just underpaid, and then in terms of them, with the now taking up traveling and just in general with the healthcare stuff, patients that could have been and where they were in ASA 1 or a 2 or a 3, where they started getting more and more unhealthy. If they had just been stopped earlier, maybe COVID wouldn't have taken their life. And so it really was eye-opening again, and I think it lifted that shade and that veil off of the healthcare system in this country. So while we may have been making progress, I think having something as systemic and as widespread as COVID kind of really showed where we have room to work.
Yeah, I think we all have to advocate for the notion that everyone should have a primary care physician. And the issue is who pays for it. That's a political decision. But at the end, every American in the wealthiest country in the world should have access to a primary medical practitioner and a dentist. And the primary care practitioner and the dentist have to have the ability to communicate, portable electronic medical records, so that it's all in one place. And I'm afraid my generation has not done a good job. So we can internalize that, as we in the accounting profession say, to your generation. So
you're right. I mean, I would love for there to be a centralized EHR or some kind of documentation system that everyone has access to. It's very difficult. And it's not even like I think you hit the nail on the head. Even communication is difficult, just across getting between different groups, different practices. It's tough, and I think if anything, it's been a little disheartening just seeing when I got thrown into the trenches of it all, just kind of seeing where we are in healthcare, and I'm still optimistic as ever. I still think that things can change and we can still make things better, but we have some work to do.
Well, I think unfortunately the next generation is going to have to do it. You're going to have it, and organizations like ASDA are going to have to speak up, I think, to the profession and say, this is what we as young people want. We want a healthier population, and we as dentists want to contribute to that. So
right. I agree 100%. Yeah.
Have you stayed in touch with ASDA?
I have actually, yes. I'm actually heading out there this weekend for their annual session to give another talk. I gave a talk also in Chicago last year. I'm still pretty involved with them. Actually, and when we talk about a little bit about technology and stuff, I'm excited to talk about some of the initiatives we're undertaking with technology as well. And I've been kind of directly involved with their technology group in terms of like expanding that area of the organization. So yeah, I've been in touch with them. Yeah.
That's cool. We're doing a lot of work with AI now, and able to scan through imaging and look for challenges that are hidden there in the patient's record and bring it to the attention of the practitioner through AI. Just scanning through all the millions of extra images that are in there in these practice management systems. A lot of opportunity there.
Oh, 100%. My dad's actually a computer science professor, and he works in neural networks.
Oh, really?
I remember he would sit down and have these riveting conversations with me of literally what you're saying, having the computer read through stuff, understand almost intellectually, and be able to kind of decipher and figure out what, like if it's in healthcare, figuring out what's going on, having them interpret radiographs, interpret treatment plans, kind of to give you what the best percentage of success in certain situations. I mean, it's exciting, it's scary, and it's kind of like fun, just fun to think about how far that field on its own is going to progress in the next even 10, 15 years.
Right. So as somebody in private practice where I'm sure your day is heavily scheduled, do you find time to look at the technology?
Yeah, I actually, it's funny. When I'm sitting around, I'll look at like just random stuff on the internet, find out kind of where we are, what we progressed. Or some of my colleagues will send me cool things, on Instagram, Facebook, just social media in general. Just, hey, can you believe what's happening now? I mean, I remember that's how I found out about the robot, and I think it was in China that placed the dental implant completely on its own, no practitioner involved. And so it was, to me, it's just incredible where these things are headed. And I remember sitting also in Buffalo, they brought I always forget the name of it. I think it's the Yomi, or the robot, where they'd come in and they also do the same thing with the CT guided implant placement, where literally you can teach a monkey to place a dental implant now. And it's incredible. It's still very expensive, how technology always is at the beginning. It's kind of, but I think just we saw ourselves, like I remember when I was in undergrad, I actually worked on an E4D scanner for Henry Schein. And I actually was I wasn't even a dental student yet. I was fabricating crowns, and just seeing where that E4D machine has now, what you guys have turned it into over the last 10 or 12 years, the speed, the technology, the scanning. I mean, it's a totally different ball game. So even things we have now will continue to progress to be faster, cheaper, and more economical.
Well, the latter is what you said is very important. I think the price of a scanner is coming down. The functionality is growing up, growing, and I think that we are very, very close to scanning becoming standard of care. The quality is really good.
Yes.
The price is coming down, and it's interoperably connected to the practice management system. So I think we're there. But firstly, I want to thank you for spending time with me again, and for because I know our team will watch us, and I think Dennis and the industry will watch this interview. But as we taper down the interview, I want to ask you perhaps a little bit of an unfair question. What's your prediction for dentistry over the next 6 years, so that when we meet again in 6 years, we can check what you had on the list and see how right you were? And
I would love to see, I think, and I'm really excited about the stem cell research when it comes to regenerating dental tissue. I think when I've seen it and some of the stuff I've heard, that I think they're getting close. They're on the cusp of it, and that's going to be revolutionary. I mean, nothing we've created in terms of dental restorative material has come close to regenerating. And that's not true. I guess I should say it has come close to mimicking tooth structure, but nothing can be the same as general tooth structure. So the fact that one day we may be able to actually use a filling material that literally mimics dentinal tubules, just in general, and the structure across, I mean, to me, it's mind-boggling. One thing I also see too is, like you said, the standardization of technology across dentistry. I think, and I hate to bring this up as being an issue, but I remember when I was in dental school, I never really had the opportunity to access a lot of dental technology out there. Like, I had worked on an E4D scanner during undergrad. I got to dental school 4 years, never even did one CAD/CAM crown. So that to me was kind of mind-boggling, that even across America, there's not a lot of standardization in terms of the training of the dental professional regarding actual technology and access and what's even out there. So I feel like a lot of graduates are graduating a little bit behind the curve, and not all. Some schools do a great job, but I'm excited to see kind of the standardization of that technology across. So that way, as a whole, we can only advance once everyone advances. So that's one of the things I'm excited about, and I love that Henry Schein has been kind of a leader and a proponent about technology. And working with ASDA, one of the things we're working on is like we're working actually a dental technology expo to standardize and give access to all dental students to all technologies. So someone like me who never touched a scanner will get an opportunity to touch it. And companies like you guys, again, we love, and I've already been talking to some of your team on the national level and getting you guys involved, coming in as the leaders and showing them, a school that may not have access to some of the stuff out there, say, hey, well, we'll teach you. We'll show you what's out there. So when you graduate, you can continue to advance on technology. Because as a whole, once we get faster and more efficient, it'll eventually become more affordable.
And then more people are going to go to the dentist for the same money we're spending. So we worked with the National Prosthetic Association, I forget the name, on developing a curriculum that was to be adopted by deans in 2019. It was adopted so that every dental school had agreed to a similar curriculum for digital dentistry. I think those kinds of things will advance digital dentistry and the digitalization of the entire healthcare continuum. Because once you are digitalizing dentistry and you're digitalizing medicine, it'll come together if, by the way, people want it. Because there are still providers of software that don't want to connect to other software.
I know, I've lived it. I know what you're talking about exactly, and I think that's something we also have to work past, the education that it's okay to change. It's okay to reach out to what's new. It's ultimately what's best for the patient, and what's best for the patient is what's out there. Then we need to bite our pride a bit and realize that it's okay to change.
And it's very important to have open architecture and interoperability. Those are the things that are if you think about the railroad, if everybody kept their own gauges, we wouldn't have a national railroad system, and
exactly,
we wouldn't be able to move stuff across the country. And in every part of commerce, you need some form of standardization. You can't keep the competition out. So we've always advocated for open architecture and interoperability. So that'll be important, I think, for the future of dentistry. So, I appreciate you spending time. I think people will enjoy this and see how somebody that was committed to organized dentistry as a student is now successfully operating in a private practice in a dream city. So I don't want to say that there are not other dream cities, because I don't want everybody to leave New York. And if you can push for that stem cell, it'd be great, because I need it for my knee, skiing, and it's just about there.
Oh, man.
My orthopedist says to wait a little bit before he puts it in.
Yeah. That's an honor to have. And I gotta say thank you so much for having me again, Stan. I mean, it's always a pleasure. 6 years has gone by fast. I can't wait to see what's going to happen in another 6 years. I always have fun with our chats between you and I. And yeah, I mean, hopefully next year I see you in 6 years, you'll be skiing, and then no noonie, nothing.
Well, I want to come out to Seattle and ski. You've got some good mountains there.
No, we do. Yeah, please come out. Let me know. We'll have you here.
So, everyone, thank you all for tuning in. Dr. Silliman, who was president of ASDA 6 years ago. We spoke to Dr. Silliman 6 years ago about his thoughts on the profession, and now he is the profession. So thank you all for tuning in, and we look forward to having another meeting 6 years from now. Thank you, everyone.
What a great conversation to kick off the program. Thank you, Stan and Dr. Silliman. Our next segment, the progress and promise of interoperability, the next 5 to 10 years, will be led by Mike Baird, CEO of Henry Schein One. Joining Mike will be Rachel Nelson, president of Exxon Group, part of the Henry Schein One family and the developer of the leading software in dental schools, along with former ASDA president, Dr. Tanya Sue Maestas, now dental director at La Clinica de Familia in New Mexico, and Colton Cannon, the current president of the American Student Dental Association, who's pursuing a Master's of Public Health degree in addition to his Doctor of Dental Surgery degree. The discussion will focus primarily on the subject of interoperability between dental and medical electronic health records, why it's important, and how it impacts overall patient outcomes.
Hello, everyone. I'm Mike Baird, CEO of Henry Schein 1, and I'm happy to be joined today by Rachel Nelson, who is president of our exam group, Dr. Tanya Sue Maestas, who served as president of the American Student Dental Association in 2017 and is currently a practicing dentist at a federally qualified health center in New Mexico. And last but not least, Colton Cannon, who is currently serving as the president of the American Student Dental Association. Rachel, Tanya, and Colton, I'm thrilled to be with you today to talk about the future of interoperability between dental and medical electronic health records. I know this topic came up for both of you, Tanya and Colton, during your respective conversations with Stan Bergman, and I'm looking forward to continuing the dialogue today. What does interoperability mean to you? How do you define it, and why is it so important to the practice of dentistry? And to start, I'll hand it over to Tanya.
Yeah, thanks so much for having us here tonight. I think that this is really exciting for us to kind of share our ideas and vision and get Colton's perspective as a student and my perspective as a new dentist and what that'll look like in the next few years. But, interoperability is, when you think about it, an opportunity for us as providers, as dentists, to see a patient and their whole being, to get their whole story. One of the benefits of working at a FQHC is I have the opportunity to work alongside a lot of our medical providers in the building right next door to us. So that opportunity to see and work with those providers and understand that our patients are not only seeing us, but also them, allows for us to communicate about our patients. And it's also a great way for us to kind of look at their EHR. We use ECW here and look at their records, check on their A1C. Most patients come in and they don't know what their A1C is, and that is crucial information for us to know. So it's small stuff like that that is really, really convenient. And I can see that the future of medical and dental and that interoperability include that and be a standard across the board.
As we learn more about how integrated medicine and dentistry are and how the mouth is really part of an overall picture in the overall body, as a student, we learn so much about how connected the body is, and we learn so much about diagnosis and be able to have good clinical care. I think interoperability is having the framework and infrastructure in place for you to make those best clinical decisions with the most accurate and up-to-date information and not have to be wondering about certain facets. You can really have the ability to be able to see the information you need, see the information required for you to make an educated clinical decision.
That's fantastic. Rachel, I'm curious if you have any thoughts as someone that's worked in the space for many years.
Well, I feel like I just want to steal what Tanya said. I love that. It's telling a story. And I really think the power of data really is what we do with it and how we use data to tell a story. So I would probably expand on that to look at, what sort of data should we be sharing? What is relevant data? Do we have standardized data to make this more accessible and easy to use? And so when I think about interoperability, I'm thinking usually more into the data side of it. And how do we make that as easy as possible that providers have the appropriate relevant data to make the best clinical decisions? And really all it is being able to share that information across systems.
I was
going to say, Tanya, I'm actually curious, just to follow up on your point. You work at a health center, and so you have easy access to records. Is it just as applicable if you're in a regular dental practice?
I think it's applicable. I just don't know if it's being used at this point. I think that the direction is headed that way, but I don't think that there is a opportunity for many dental providers to check in on their patients' medical records. I think that there are some systems and some EHR records that are allowing that now, but I don't think that it's the standard quite yet. I hope that it does become the standard of care one day, because I think that's the best way to truly treat a patient. And it's funny, we talk about the story, and patients come in with their stories, but sometimes they don't have the whole picture, or they bring in their understanding. So to see kind of the backside of things and what they're doing with their physicians is really, really helpful. It really is nice to work here, because if something kind of goes south or I have a question, I can just run over next door and that access to have a medical provider there, kind of be there and have that fail safe almost is really, really reassuring to me and to my patients.
I think Tanya made an excellent point about telling a story. When we approach a patient, they have a story, they have a medical history and they have a dental history. And to be able to not put the entire burden of being their own medical historian on the patient, but really to use sound data and allows us to make those clinical decisions. I think once you have that information, you're able to know the patient's story, know where they've been, will allow you to be better able to know where they're going. And I think that's really, really crucial for us in dentistry, is to be able to have that interoperability. As Tanya works at an FD, she has the ability to have a medical colleague just down the hall if she has a question. But I think be able to have the data and have the infrastructure in place where that information is easily relevant and easily presented to the dental counterpart will allow the exchange of information in order to have a more seamless and comprehensive care model, and not have to put the burden on the patient to be their own medical historian when coming into your practice.
I'm curious, Rachel, both of the people here have talked about how when you're in an environment where healthcare and dental are so closely related, so when you're at a dental school, for example, many of them are co-located with the medical school as they see patients, or in an FQHC, as we talked about earlier. And from the Henry Schein One side, you work with dental schools, so you are probably at the forefront of seeing interoperability in practice at many of these clinics. From a technology perspective, I'm curious what you think some of the roadblocks are to interoperability.
Yeah, I think the roadblocks, we're on a journey, I think, as a profession. And so even when we talk about, what are some of our goals, we really make the goal expanding interoperability, because I don't see it as a fixed target. I think that, what I've seen happen in the last 10 years, a lot of it originally was, do we have standardized diagnostic codes? And 10 years ago, dental schools weren't using standardized diagnostic codes. And that almost actually became the first benchmark on how do we play in this interprofessional environment when we don't even have standardized language. And so seeing progress happen in that way. And then, with a lot of states expanding to saying we're requiring that you do electronic prescriptions. Great. What did that give us? Well, automatically, if you're using electronic prescriptions, you're able to, within any EHR you're using today, upload alerts, allergies, medications, prescriptions, just through, your dental EHR. And so that kind of was, I think, the beginning stages of it to what we're seeing today, which is it's expected that you should be able to use your software and pull in actual medical data. And that's not only, I think, our opinion on it, but it was actually legislated by the government. So there's legislation that's supporting this, that systems should talk together. And we're seeing a lot more activity within this space. So whether you're going to a consolidated record or whether you're saying we want to use the best in breed within dental software, and having our systems talk to whatever your medical record is. And I think we're now seeing the movement even into, we don't have a federal medical record, but we're seeing movement in that space to saying, if there is national or state records, can we actually talk to that? So we're not even pulling data from a single hospital, but we're looking at within the state, can we pull data across multiple medical records? So that's kind of, I think, where we see this going. But again, I don't know if I believe there's an end target in this. I think it's constantly expanding, and that solves one piece of the puzzle. But a really big piece actually is, what is relevant data? And, we talk, I think, on the dental side, there's a hunger for access to medical data. You talk on the medical side, there's physician burnout with the amount of data that they have that they don't know what to do with. On every day that someone is in the hospital, on average, you're seeing 8 to 14 lab tests per day that you're in the hospital. Is that relevant? Imagine the amount of time it would take to go through every single access piece of medical data before you could treat your patient. It's not realistic. We need to have a summarized view of relevant data to properly and accurately treat our patients. I would love to see some sort of benchmarking around what does best practices in this space look like, so it's standardized. We have some form of that, again, through federal legislation, but I think it has not been built out through a dental lens, which is really, really important. So again, I think there's progress that's being made. We're directionally correct, but there is definitely things that prevent us from doing this, I think, the way we want it to be, but we're going in the right path. Did that kind of answer the question?
One of the things that I would add to that, if you think of a standard dental practice and they're seeing a patient, well, what is that patient's healthcare record? And I totally agree. There's definitely an information overload, right? Do you want 10 years of a patient's history, or do you just want to know that they have cardiology issues that you should be aware of, and certain medications that they're taking, and sort of figuring out the right filters on that is certainly a challenge. Colton and/or Tanya, I'm curious if any of that resonates with you. Do you see some of those similar roadblocks in your day-to-day practice?
Yeah, absolutely. I think knowing what the important data is crucial. Time is very valuable to any provider, and be able to spend the time to be able to ask the right questions and to be able to spend the time giving your patient care is ultimately the benefit. So the less time you have to spend sorting through the data, the less time you have to look for the questions you need to ask, the better off you're going to be providing that care. We all know that we live in a data-driven world right now. Yet being able to find what's important and being able to have the systems in place to be able to direct you to what's important, I think is crucial in your ability as a clinician to ask those questions and then follow up if necessary.
That's very well said. And Colton, you know that as a student, time is really of the essence, especially if you want to get all your requirements done and graduate. But, I will say that you can get that information overload, and it can be almost like playing I Spy to figure out what you're looking for, what's pertinent, what's most important to you as a dental provider. So that can be a little bit difficult. So finding that streamlined, some way to kind of extract all of that would really be best and help kind of move appointments along.
I'm curious, Rachel, because you see many entities that are doing this today. What does success look like?
I think success looks like when you consider the entire workflow. A lot of times we think purely on the technology side. So we think, does the data pull into our system? I think taking a step back and actually thinking, how do we want this part of our patient experience at the dental school? And so whether that's how you're screening your patients, how you incorporate your medical health history, how you're teaching your students to review this data. So taking a bit more of a holistic approach to what role does medical play within the healthcare ecosystem that we're serving in, is probably where I would guide our customers to go towards, as opposed to thinking it just purely as the technology or the infrastructure piece to it, which is very important, because if it doesn't do what you need it to do, you're not going to be successful. But I think that's only one piece of a bigger part of the puzzle.
I'm curious again, and Tanya, we'll start with you. Are there any particular stories or things you've seen where you've seen benefits to having access to that total health profile on a patient?
I hate to go back to the A1C scenario, but it's huge here in the community and those that we serve. Diabetes, the prevalence here in the borderland is very, very high. So knowing somebody's A1C, knowing if they're on a bisphosphonate, knowing if they're on a blood thinner, where many patients may come in and not know what their health history is. They know that they take medications, but they may not know what they take. It's really, really crucial to know that. At many FQHCs, health literacy is not very high. And while we do our best to educate our patients and they do their best to also learn alongside us, oftentimes they may not know why they're taking certain things. So that is a really big benefit for us to be able to go through all of that and ensure that anything that we're doing to our patients, we're not causing harm. So if we're going to extract a tooth, we want to make sure that, they're not going to go home and bleed out and cause more issues, because we want the safety of our patients to be a priority.
I think Tanya answered that fantastically. So many of our patients face numerous different challenges, whether they're perfectly healthy to on the other side of that spectrum. Being able to have that information as a provider allows you to make better dental choices that might impact their overall health. So I think from a public health perspective, the more well-versed you can be in what the situation that particular patient is going through, the better educated your dental decisions can be, and the overall greater effect you can have on influencing the patient's oral health and overall well-being.
So if you could change what interoperability looked like, where would you like to see progress over the next 5 to 10 years? What are the things on your wish list?
You know, I think it goes back to what we were just speaking about, making it streamlined, finding a way to where when you look at somebody's chart, you have what you need right away. And sometimes you have to dig, and that can be time consuming. So, you know, I don't know how any of that is done as far as software goes, but trying to streamline that and making it for just user friendly so that way everyone can kind of just jump in and get what they need.
I think, you know, being able to have the information you need and be able to use that information appropriately and relevantly. The last thing you want to do is have to dig for information from your patients, go chase down different records, go try to figure out what medication exactly your patients are on. I think being able to have that information presented right forward to you not only improves your ability to act as a clinician, but also improves the experience the patient has with you.
So Rachel, is someone that's working on, you know, software like this, where do you think the progress will be made over the next 5 to 10 years? And how are you going to bring that vision together that Tanya and Colton so eloquently laid out for us?
That is a good question. I think what I love that I thematically have heard through all this, you know, like we're talking about the concept of interoperability, but when I go back to, I think Tanya's first comment around storyline, what we're actually talking about is patient-centered care. How do we see the whole patient when they sit in the chair? And we're not seeing just their head, we're seeing the whole patient. And I think that's where the future is. And so there's aspects around how does this work within the medical ecosystem, but there's other aspects actually. There's aspects about how does the patient engage with their own record. And Mike Baird, you know better than anyone else that we're super passionate around patient communication. How do we have patients having access to their own data? It shouldn't be something that they don't know and they don't understand. How do we make it more relevant to them? So I think there's multiple pieces here. One, it's bringing in that relevant data, again, into the clinical record. So we have access to important information that we need. But actually, how do we then share that information so that dental visits are bigger than one-stop shop, right? It's where, you know, we look at Apple Health. A lot of people wear, you know, we track our steps. There's really cool things happening in the dental innovation space around, you know, Bluetooth toothbrushes, being able to have apps and track all of that. So I think there's actually a lot that's going to happen within consumers driving their own personal health records as well. And that to me is actually really exciting and passionate. And I think when you look at, you know, what's happening in terms of technology, where we're seeing that the consumer is more powerful than ever. And so we're going to have it on both sides. What role do we play in terms of accessing that information? But then what role does the patient play as the center of their own healthcare record?
Those are some great thoughts. A few just to add to that. I love the way you brought up consumerization, and I think that tends to end up solving these problems for us. So on the one hand, particularly in the United States, I'm not certain we'll ever have a singular patient healthcare record or registry, though I do think we'll see various standards that help make it easier. So we're seeing the rise of standardization through things like Carry Quality or Commonwealth, where they're trying to build common data standards to make it easier to exchange information. But even in that instance, right, where a patient interacts with so many different healthcare records, it can be a challenge to find which one to integrate with. I actually think the consumer will end up solving that. I think you brought up, you know, Google and Apple Health, some of the platforms that they have there, where if you think about how easy it is to decide today to share your sleep data or your weight data or whatever it is with whatever apps you want to, I almost wonder if the consumer becomes the consolidation point. And if that patient is actually syncing the relevant data from the various you know, medical providers that they see, or the various medical tools that they gather data on, and then when they work with a dentist or other healthcare provider, they can choose, you know, what to share. And in a future world, you can imagine it being as simple as a dentist being able to say, well, I want to know your major things and your health history and maybe your most recent prescription data, but I actually don't need everything from, you know, when you were 5 years old or whatever it may be. I actually think that we end up finding a lot of those solutions, and I hope we'll build off of that. I think the other big trend that I think will help is data is turning from the inside out, meaning instead of it being captive in thousands of little databases everywhere, most platforms are opening up an API, which is basically a plug-in model that makes it easier for other sources to get to that data. And I think those trust relationships will be built across most platforms. They're built that way natively. If you look at the way Amazon works or Airbnb or other consumer platforms, they're built with these open access points to gather data. And so I think we'll see that trend throughout these various databases, whether it's an electronic healthcare record, whether it's your dental record, whether it's other things to make it easier to share. So I'm very optimistic that we'll see the industry continue to evolve in that way, and that will ultimately result in better care, as both Colton and Tanya have discussed. I would love just to get closing thoughts. If others have other thoughts they'd love to share on this topic, and maybe as we go around, I'll start with Colton this time, and then we'll go to Tanya and then Rachel. Any other thoughts you have about the way you see interoperability and the promise of it in the future?
Yeah, I think kind of from a student's perspective, we're constantly learning new things. We're becoming more and more integrated healthcare providers and more well-rounded with technology than generations before us. When we enter out into the profession, we have a desire to have that information be able to be present. And I think it's exciting for new dentists and exciting for students as well to be able to put all those pieces together and being able to truly see how so many various aspects impact a patient's health. And I think like that's something that makes me really excited. And I think that's something that interoperability can play a huge role in, is being able to put those pieces together so clinicians can have that great viewpoint. And I think students and new generations of dentists are really looking for that, and they're really desiring that. I think that's going to be a great push to be able to have more kind of sharing of data, sharing of records, and be able to have that more streamless care.
Tanya, what do you think?
Yeah, technology in dentistry is so exciting. And to see different softwares and technologies come out to help that interoperability is also very exciting, because I think that, we're going to streamline that process for both the consumer and for the patients. So I'm excited to see, what comes out in the next few years, what gets integrated in different places, and what role we can play as the millennials and the new dentists in this world to influence some of that change into the future.
Rachel, what do you think?
I think I'm just echoing what everyone said. I think there's never been a better time to be in the profession. I'm so passionate about what I do, because I always say, like, intersection between healthcare and technology, like, is the coolest thing. We get to do things that are fun and interesting while making a difference in the world. And so I'm inspired by meeting with the future of the profession. I thank you for your insight and your time. But yeah, this is an exciting time.
I think those are all great thoughts. I love that both Colton and Tanya used the word excitement in what they talked about. And Rachel, you talked about passion. It definitely is a time of great change in the industry. And I think it's great to see the passion that you all bring to the discussion. And I think I would encourage anyone listening to it to contribute their thoughts to the discussion. I think this is one of those things that the market evolves based on the demands of patients and the insight from dentists on ways to deliver care in a better, more comprehensive way. And ultimately, healthcare has a way of upgrading over time. We get better and better at doing these things, and we have much better patient results. So really appreciate Rachel, Tanya, and Colton for your contributions today, for the thoughts you're bringing to this, not just in today's dialogue, but as an ongoing conversation in the industry. And really appreciate your thoughts. And thanks to everyone that listened in. I hope you have a wonderful day. Thank you.
Thank you all for your insights and for highlighting the need for healthcare providers to have access to a single healthcare record. And now for our final segment of the program, New Perspectives from New Professionals. We'd like to present a panel discussion moderated by Gabriela Garces, Zone General Manager for Henry Schein, which will take a deep dive into the challenges in expanding access to oral healthcare and how each participant is working to advance access to care within their unique specialties. Gabby will be joined by 3 former ASDA presidents, Dr. Rupali Kulkarni, Craig McKenzie, and Sydney Shapiro.
Hello, everyone. I'm Gabby Garces, a Zone General Manager for Henry Schein, and I'm happy to be joined today by 3 past presidents of the American Student Dental Association. With me, I have Dr. Rupali Kulkarni, faculty at the University of Pennsylvania School of Dental Medicine, Dr. Craig McKenzie, resident at the University of Pittsburgh in the Department of Dental Anesthesiology, and Dr. Sydney Shapiro, pediatric dentist at the New York Presbyterian Columbia University. I'm thrilled to be sharing the virtual stage with you 3 today. During the panel discussion, we're going to be exploring some of the high-level issues and trends we're seeing today as it relates to the prevention of oral disease and the promotion of oral health. We have a powerful opportunity today to create actionable conversations as we deal with the many consequences the pandemic has brought. I know you're all passionate about this topic, and you each are helping to advance oral health and access to care in your respective specialties. To get us started, perhaps you can each share one of the challenges you're seeing facing the dental profession today. Let's start with hearing some thoughts from Rupali.
Thank you so much. So as an educator myself, it's one of my goals to truly empower the next generation of dentists to feel comfortable treating patients from all backgrounds. As an oral medicine specialist, it's part of my scope of practice to work with people with disabilities. And in seeing our aging population, we've noted an increase in chronic diseases. And so as our patients present with chronic diseases, or there's a rise in treating patients with people with disabilities, I think access to care in a sense of treating patients that might not be able to seek care in a traditional dental setting is a huge challenge, not only in our dental facility, but in the communities that we serve. So my goal in being faculty, even in our people with disabilities clinic, is to empower dental students and future generations of dentists to be able to work with patients from all different backgrounds.
Thank you for sharing your thoughts. Craig, I'll toss it to you to add.
Yeah, I think one of the biggest challenges, kind of to echo what Rupali was saying, is finding a facility or finding a dental home for a lot of these special needs patients that are unable to cooperate for dental treatment, whether they want to or not, as well as for young children that are also not at the age yet where they really know what's going on at the dentist. So within my field of dental anesthesiology, we provide more access to that by going to the patient at their dental home, providing those sedation services so that they're able to get the oral health care that they truly need right there at their home. And I know here at the University of Pittsburgh, we've been able to provide that access to a lot of these special needs patients and pediatric patients, but patients are driving so far to receive these services. So hopefully we're able to expand that so that patients aren't having to drive so far to find that care.
That really is a good point. You know, finding children their dental home by age 1 is really a critical need, right? As we get started within the opportunity to create better oral health for our youth. Sydney, anything to add on your end?
I do. Tying into what Rupali and Craig said about access to care, and something that we as new dentists and past ASDA presidents are very passionate about, is the amount of student debt that recent graduates have and how that indirectly affects access to care. When dental students are graduating with extreme amounts of student loans, their postgraduate opportunities can be limited. They might not always go to areas with dental practice shortages, hospitals, academia, because of their debt burden. It's something that ASDA has been advocating for a very long time. Student debt reform is one of our main advocacy initiatives. And so I think that that's something that the dental profession is it's a challenge that we are facing right now, and something that ASDA has been working on to help alleviate.
That's a really good point, Sydney. I do agree with that. Debt and the passion to go and serve, and some of the consequences that unfortunately student debt has. Where is the dental association from here? What have we done already with debt, the awareness of debt within dental students?
So I can talk about from the last 2 years, perhaps, as I've been president and immediate past president, and then I can have Rupali and Craig chime in as well. But working with legislators over the last 2 years when COVID hit and students were not in school, having before the interest rates were paused, reaching out to legislators about student loans and pausing the interest rates. And then, hopefully as we move forward out of the pandemic, being able to support students through the transition back to interest rates and payments being started.
The ADA, the American Dental Association, and ASDA at our joint lobby day each year have always included some sort of student loan refinancing or the ability to consolidate federal loans at a lower interest rate, which currently isn't possible. I think something else we really need to look into is the ability for graduate students, including dental students, to be able to take out those subsidized loans, similar to how undergrads are able to take out those subsidized Stanford loans. There are loans in the marketplace currently that could help with the student debt burden, but they're unfortunately not available to graduate and professional students.
In addition to the tangible actions in terms of changing legislation or working with external organizations, I think one of the things that ASDA has come to at the forefront is also educating students on non-traditional paths and what opportunities there are available in terms of scholarships or loan repayment programs, so that you may be able to pursue a career in public health or academics, or perhaps serve in the military. And I think as we allow students to learn more about those opportunities and create spaces where students may be able to apply for those, I think that could also alleviate some of the debt burden, as well as encourage students to address some of these pieces of access to care.
From the different opportunities that each of you have raised your hand for when it comes to public service and the opportunity to be a part of the public health education, what are one or two of the biggest positives that you believe you've become a better dental professional because of this type of service that you've been a part of?
Well, for me personally, I pursued a dual degree and got my master's of public health while I was in dental school. And then I chose to pursue oral medicine as a specialty. And the interdisciplinary nature of care is something that is truly rewarding. I think we learn a lot more about how the oral health of your body is truly connected to your systemic health. And in order to understand what impact you can make in public health, at least for me, I had to remember that I was on a team of people providing care to someone. And in thinking about patient-centered care, I think sometimes we can become insular. So I always say in dentistry, we're working in the millimeter, but in public health, we're working in the landscape. And I think it's a very nice dichotomy that has allowed me to connect with my patients on a more personal level, although my education has brought me to that population level health.
Thank you, Rupali. Sydney.
Absolutely. Like Rupali, I also pursued my MPH during dental school. And so I feel the same way, the interdisciplinary care, realizing that you're part of a bigger team, and also realizing that when your patient comes to your office, it's not just those 45 minutes that are affecting their oral health. There's so much more to their story and to the barriers that they're facing, what got them there today, how you can help as an educator. Rupali is very passionate about education, and so is Craig. And I think that we all, in addition to educating peers, colleagues, students, every day we're educating our patients. And that's something that is so powerful, that we can give them that opportunity to take the time to teach them about oral health and how it relates to their overall health, and be there as a support for them.
Thank you, Sydney. Craig?
Yeah, and I mean, to kind of change the conversation slightly. My master's isn't in public health, but rather in education, just to be the odd one out there. But education still is a public service, and it's all about preparing the next generation of dentists. You have 3 future specialists, or I guess 2 future specialists, and Rupali, who is a specialist on this call. But it's the general dentists at the end of the day that are caring for all of these patients. And it's our job as educators to ensure that they're equipped with the skills to work with those special needs patients, to work with those young kids, so that access to care can occur wherever and not just in these specialty care centers. So I think a lot of it is about educating the future generations so that they feel empowered and feel confident in being able to treat all patient populations.
Well, your collective passion for public health and education is definitely a big part of this, right? We have to be able to inspire and educate the future in this capacity. And thank you for doing that in each of your responsibilities that you have. So how can we collectively help educate patients and society overall? And I mean collectively as a dental industry, not just dental professionals or dentists, us in the organizations that we serve in dental industry, as well as all society as a whole. How can we continue to educate oral health?
It starts with removing the silo that dentistry has historically been put in, separate from medicine. So much can be accomplished when we work together with all aspects of healthcare, particularly as a pediatric dental resident. I see this with pediatricians. They see young patients several times in the first year of their life, and working with them to educate new parents on why and when they should bring their child to the dentist. Like you said before, the importance of the 1-year dental visit is something that they have a major role in. And, working together to educate them, to educate our patients, and educate society as a whole is incredibly important. And doing so, it doesn't just rely on dentists. It takes many people in healthcare to integrate us into a more beneficial society and healthcare.
Yeah, Sydney, I completely agree with your thoughts as well. But from another perspective too, the 21st century, not just in dentistry, but battling the power of misinformation. And I think all of us see this in our practices in dentistry as well, whether it be, oil pulling or charcoal toothpaste or whatever that latest fad might be. Not only that it's not benefiting somebody's oral and systemic health, but actually that some of these fads on the internet are actually causing patient harm. So I think a lot of that is our responsibility as dentists to provide that education, but it's also on the partners of dentistry, Henry Schein and other consumer organizations, to provide that education as well, and make sure that the products out in the marketplace for consumers, for our patients, are ones that benefit them in everyday life.
That's so funny you talk about dental fads. All of my friends, because I'm in dental, they automatically assume that I can give actual clinical advice. And they're like, what's this latest like charcoal whitening kit and toothpaste that I should try? I'm like, just go to the dentist. I can't give you any information like this. Like, the best person to advise you on what to do with your oral health is your dentist. Go see them. They will make that recommendation. So it happens. It's so easy to get stuck in, all the social media, Instagram stuff that gets pushed to all of us. So it's important to steer clear of those dental fads. Rupali, anything else to add?
I think it's so interesting when Sydney and Craig were speaking, I said, I resonate with what they're saying so much. And I have this little phrase I always say that they're aware of, because I love alliteration. And I always say, educate, engage, and empower. And I think, as Sydney mentioned, part of the education doesn't just come from how we educate our patients or how we educate, perhaps our staff, but it's really how we work with our medical colleagues as well, that we are one piece of the puzzle. And like I said, when we focus on that patient-centered care, a big part of it is thinking, how are we contributing to someone's overall health? And then when I think about engage, I think a lot of it is how that information is disseminated. So yes, in our social media world, our world full of technology, I think we can actually leverage the fact that globalization has made our world smaller so that we can promote healthy habits and actually initiate campaigns to talk about how you can better your own oral health. And then to empower. So at the end of the day, the goal of that is to allow individuals to feel comfortable with, taking care of themselves, or perhaps taking care of someone, if they're a caretaker for a person with a disability. How can they learn that information? So I sort of see it as a progression, and it's almost a little combination of what Craig and Sydney were saying that really resonated with me.
Thank you. That's great. There are many dimensions to access to care, both in dental care and the wider healthcare services. People with disabilities face a particular range of barriers that can prevent them from accessing appropriate care. What are some of the misconceptions about treating this population that you'd like to see change? I'll toss it over to Craig to start the conversation.
I think one of the bigger misconceptions is that they have to go see a specialist, or they have to be in some advanced care center or be seen at a surgery center, for example. But the truth is general dentists have the skill set needed to treat these patients, and either on their own with additional CE and special needs that I know is definitely being offered now across the country, or in partnership with someone like a dentist anesthesiologist. They're equipped to see these patients right at home in their office. And it's a great way to expand their practice. It's a great way to serve the community. And at the end of the day, it's honestly the right thing to do, so that these patients don't have to drive 2 hours to a specialized care center. So I think the message to drive home is you can do it at your dental home, back at your practice.
Yeah, especially with the advancement of technology, Craig, as you mentioned.
Absolutely.
It's incredible the things, the technology that we've been seeing just in a short couple of years in dentistry as a whole. So, Rupali.
I think one of the misconceptions is that all disabilities are the same and that we don't know how to treat them. And it's interesting. So being, like I said, a faculty member in our People with Disabilities clinic, one of the teaching moments I've been able to share with my students is that having a conversation with someone can go very far. Creating a comfortable space for someone and explaining what you're doing, even if they might not be able to respond back, you never know what someone is understanding or gaining if you take a moment to educate them on what you're doing. And I think, even just with technology, simple things like lowering the lights or playing calming music can help patients feel more comfortable in the chair. And the more the exposure they have, the more likely they are to come back. So I think it's about, number one, admitting when you don't have all the information and understanding and knowing that not all disabilities are the same, but two, being willing to even try simple things, just that simple conversation of, let's try this. Let's see how you do with this. I'm going to use my mirror just to take a look. Breaking it down into those simple steps can actually make a big difference.
I think going off of what Rupali said, one of the misconceptions is the time that it takes in an appointment. And Rupali touched on a lot of techniques that make it more comfortable for a patient with special health care needs in the dental chair. And, they might need to come in for a couple more appointments to desensitize them to the dental office. And that does typically take more time, but the misconception is related to, how much time that is. The challenge is related to the complex medical needs of each patient. And I think listening to Craig and Rupali and thinking about the complexities, the way to address those misconceptions are through education. I know we've been talking a lot about that, but that goes for education for dentists. CODA in 2020 added the requirement for treating patients with special health care needs for predoctoral students. So that was a huge step just recently. And whether it's training the dental staff at the office, parents, when they come in your door, how can you make this more comfortable for them and their child? I'm saying parents because I'm used to treating patients who are pediatric patients, but patients in general, caregivers. I think that addressing those misconceptions through education is the most important thing that we can do, whether it's as dentists, healthcare professionals, Henry Schein in general.
Is there an annual course that dental professionals have to take in this type of education, right? And with people with disabilities and being able to treat them in the best way possible? Is there some sort of a course that annually dentists have to take, or team members?
So it's currently not a requirement for special needs specific CE, although each state does have a CE requirement to renew your dental license. But I am pleased to see the increase in the amount of CE specifically targeted at patients with special healthcare needs. And Rupali, I know that you've been involved in that. Perhaps you can touch a little bit more on what you're doing at your school.
Yes, I think given the CODA requirements now, something that I think is striking is it's not just in terms of clinical care, but it's being introduced in the didactic curriculum as well. So understanding how, when you learn the basic sciences, how that might impact someone's medical condition, how does that really relate to what you're going to do as a dentist? And then really to further push it, certain associations like the Special Care and Dentistry Association, they have been at the forefront of promoting CE courses or creating more essentially user-friendly courses, especially for dental students as well. And so at our institution, that's something that we're promoting, not only to essentially complement what's occurring in the clinical setting, but to continue on that, whether that's through lecture series or through actually traveling and being able to interact with other healthcare professionals and how you can be a part of a team to treat people with disabilities. So it's certainly progressing and it's exciting. We're really at a turning point in the education of future professionals and how to treat people with disabilities.
Excellent, thank you.
And
Go ahead, Craig.
Sorry, I just wanted to add, I think the future for special needs patients is only going to get better. I think, I'm very lucky to be at a training center where caring for patients with special needs has been such a part of the curriculum for several years. We have a dedicated center for it. And third and fourth year dental students, as well as dental hygiene students, have the opportunity to work with these patients, both under sedation as well as with just behavioral management techniques. And I think more and more schools are catching on to that, like Rupali was suggesting. And this new generation of dentists is going to have skills that past generations simply haven't been afforded through their dental education. And I think that's going to be really great for this patient population.
Awesome, thank you. Craig, you really talked a little bit about the new generation of dentists and what, quite frankly, what our responsibility is today, right? As we continue to drive the new generation of dental professionals up. Before we close out the discussion, it's really about where do we go from here, right? How do we harness conversations like these and turn them into actions? So around the horn, I'd love to hear a little bit about, what you're excited about as a dental professional with the topics that we talked about today, and what are you looking forward to not only continuing to evolve and also elevate as we move through this journey together. And how do we really take some action around the conversations that we're having here? So I'll start with Sydney.
Thank you. I'm excited for these enhancements in access to care and that it's such a topic that is heavily discussed. I'm so happy that we had the chance to discuss it here today with each other. It's something that we're all very clearly passionate about. And being in this generation of dentists, like Craig said, that we have this education afforded to us, and moving forward in our profession, we are aware of access to care issues and what is required to address them. And I think to take action, we can all say we've experienced the power of organized dentistry in using our voice to create action. So for me, I'm really looking forward to being involved in organized dentistry for the remainder of my career and having the opportunity to have that power of a collective voice to make changes in our career.
Yeah, I think what I'm really excited about is the dental professionals entering the field today are very just socially aware. They care and they want to make a difference. And I think that's important as individual practitioners, but just like Sydney said, having all of these new dentists joining in organized dentistry and using that power of the collective voice, I truly hope that our generation is the one that's able to transform and revolutionize patient care.
Thank you, Craig. Rupali.
As Craig, Sydney, and I are considered new dentists, I think one of the things we've noted throughout our time in leadership is also the changing demographics of our field and how with the globalization of our world, with advancements in technology, we've really been able to, I think, push dentistry to the next level. I think it comes down to three things for me. It's education, it's mentorship, and it's community. So I know all three of us have discussed our love of education. And for me, it's exciting to see how dental academics has been able to adapt to incorporating all of this technology or these newer advancements in treating patients who perhaps didn't have access to care before integrated into the curriculum. We're learning a lot more now, I think, than we ever have. I think the second piece of that is building genuine relationships and connections, not only within the dental community, but with other stakeholders and other organizations. And so I have been, afforded such great mentors. And I think that's really what's kept me excited and motivated. And then I think, as Sydney sort of hit the nail on the head, community is really what's going to push us forward. I think the power of organized dentistry, as well as relying not only within ourselves, but within the entire healthcare community, we're going to see changes that are truly going to better the world.
Absolutely. I agree. Absolutely. With all three of you. And it's so, again, I mentioned this earlier, how the passion that you all exhibit is a true testament to where dentistry goes, for the future. And I certainly am excited for what's to come with especially your leadership in the different roles that you currently have and you will have in the future as it comes to the dental industry. So thank you for that. This has been a great discussion. I want to thank Rupali, Craig, and Sydney for being with us here today. And thank you to everyone who listened in. Looking forward to the next one. Thanks.
Thank you.
Thank you, Gabby. I'm sure we'll be hearing more from these new dentists. And thank you all for sharing your voice to this important conversation. This concludes our Optimism and Opportunities in Oral Health program. We hope you enjoyed the thoughts and insights shared from the emerging thought leaders from ASDA, as well as Henry Schein executives. Thank you for watching, and please feel free to share your feedback in the comment section.